We are expecting a few more to join us, but again, in respect of everybody's time this afternoon, we will go ahead and get started. We are recording this session, so that will be available usually within 24 hours, and we will send everybody the link to that, and then it will be stored on our website as well. And just so you know that this information that you're going to hear today is effective as of today, March 3rd. I think you will hear from our speakers that this is an ever-evolving conversation, and so we just want everybody to know that if you do go back and review things, to keep that date and timestamp in mind. But first of all, I do want to welcome you. I'm Julie Sanderson. I'm the event director for the Toledo Regional Chamber of Commerce, and thank you for joining us this afternoon. This is the first in our series of webinars planned to keep you up to date and help you understand the COVID vaccine or COVID-19 vaccine as it relates to your business and employees. This series was put together in partnership with the Employers Association and the Chamber and the V Project. And if you haven't heard of the V Project yet, I'll give you just a little bit of background, and I will put the link to this website in the chat once we get going here. The V Project is a community initiative to educate, motivate, and vaccinate the entire Northwest Ohio corridor to dramatically slow the spread of the COVID-19 virus. To accomplish this, leaders from the industry, government, nonprofit, healthcare, and education, and religious organizations have united in an unprecedented effort to effectively mobilize our community with the goal to vaccinate 70% of our population. Medical experts agree that we need that 70% vaccination rate to get to that herd immunity that allows us to be safe and helps our businesses and organizations and community members to thrive again without restrictions. If you were joining us early, you heard us talking about some of those things that we continue to experience with restrictions. There are more than 250 community leaders involved in the V Project, and more joining that effort every day. The Business and Industry Committee is just one of the many facets of the V Project, and the Chamber and the Employers Association are both part of this committee. And together we have assembled a panel of experts to provide an overview to help businesses understand the benefits that the COVID-19 vaccine offers and how to navigate the challenges and complexities associated with the vaccination process as it relates to businesses and employees. Today, we are joined by Brandon Palinski, who's the Planning and Quality Improvement Administrator for the Lucas County Health Department, Toledo-Lucas County Health Department. And he will start us off with an update on the health and science aspect of the vaccine, as well as distribution. But then we will hear from RCO law attorney, Amy Luck. Amy practices in Ohio and Michigan with a focus on employment law and litigation. She joined RCO Law in 2017, having practiced in Kansas and Missouri since 2005. We've had several of these webinars with Amy, and you'll excited, you'll get a lot of good information from her. She assists employers with all aspects of the employment relationship, including employment policies and handbooks, audits and investigations, wage, hour, and benefits questions, and defense of employee claims and administrative level and beyond. Amy is a member of the firm's COVID-19 support team, which has been providing legal counsel related to COVID-19 since the pandemic began a year ago. Also joining us today is Bob Bethel. Bob is the VP of HR and Learning Services for the Employers Association, where he leads the HR learning and consulting functions of the business while also participating in many training and consulting projects. He is also involved in public service by serving as a trustee in the Springfield Township, where he is currently in his 5th term. Bob holds professional certifications with both the Human Resources Certification Institute and SHRM. So before I turn it over to our panel, just a reminder to keep your microphones on mute to reduce background noise. But if you do have a camera, we do like to see everybody's smiling faces if that's something that you can do. Also, if you have questions along the way, feel free to put those in the chat or make a note to the side. One of the things that we do like to do is address questions at the end, because there's a good chance that your question might be answered as our presenters go on. And again, we are recording this session to be available for review, but just to remember that the timestamp is March 3rd, 2021. So in any way, with that, I am going to turn it over first. I'm going to unshare my screen here and turn it over first to Brandon.
Okay, just had to find which window was the presentation there. I'm also going to share my screen and go into a quick presentation, mostly about the vaccines and with just a little bit of the current stats that we see in the county. Okay. All right, is that showing up on your screen?
Yes.
Okay, perfect. So just as a quick refresher, we are approaching our 1-year anniversary of our first COVID case in Lucas County on March 14th. Unfortunately, we're also approaching the anniversary of our first death in Lucas County, which was the first in Ohio. Total cases as of yesterday were 35,260 in our community, and total deaths were 717, with a sizable fraction of those occurring towards the end of last year into this year. Total testing that we have done in the county is 145,500. That's actually lower than the total test. Testing sites are not obligated to report tests to us, only the positive tests. So this is what we know and can prove. The actual value will be higher for those testing sites that do not regularly report. If you do have anyone who needs to schedule a COVID test, we have a lot of providers listed directly on our website at that link, and so then they can go there. I wanted to show this just as an illustration for those of you who may not have seen it on our website. This is a look at all of our confirmed cases from the start of the pandemic to now. And as you can see, we started with quite a few in April. We had a lull. We picked back up again into July and August, had a lull, but not quite as low. And then we had our massive spike in November and December. And this is when we were really busy on the contact tracing side in the county. And it's one of those reasons why it is so important to have employees who are ill stay home or who need to be quarantined or isolated to actually follow those rules, because we just had that exponential growth of cases. It took a while for us to catch back up. But the good news, the good side of that is after that little holiday bump you see just after the January 1st line, we have been seeing a steady decline in cases in the community. In fact, where we are today, well, as of yesterday, our 2-week average is about 45 cases per day. And this is all by test result date, all this information that I'm showing. So we are steadily decreasing. That is good. We hope to stay on that trend. And that is the data kind of where we stand. For those interested, we also have this per capita map on our website that we update almost every day. That just kind of shows where we are at per every 5,000 residents and zip codes. So this normalizes all the zip codes so they're comparable. And as I said, that is on our main website. And yeah, all right. Again, before I jump into the vaccine stuff, these are your gold standard measures. We want everyone to do this. The vaccine does give us hope. It's on the horizon. It's here. We're pushing it out, but people still need to be wearing face coverings, social distancing, hand washing, and staying home if you're sick. And also that last bullet there, please cooperate if one of our contact tracers call you or one of your employees. It just helps us limit the spread and keep us in that lower cases per day, which is eventually going to help us get out of this whole thing. All right. A lot of you have heard or know about the new variants that are circulating. It is a variant instead of a strain. I know those words are used interchangeable a lot, but a variant is just a few mutations that may not affect the function or the overall classification of a virus. A strain has a lot more changes to it. As far as the 3 mutations that are the ones that the global science community is really tracking, they've all exhibited some changes in the spike protein on COVID, which that is what the vaccines are targeting to develop antibodies and immunity. So that's one of the things the reason we're tracking these is because they do have those spike protein changes. And that can be concerning because they've also exhibited increased infectivity. They spread a little bit easier. There isn't information yet as far as if they cause any severe disease, any more severe disease, but they are out there, they are circulating. In terms of the United States, this is the current information, very up to date. We've found over 2,500 cases of the UK variant, and 19 of those have been in Ohio. Mind you that these numbers are probably low because these are the ones that they have actually sequence typed in a lab. So not every person who has one of these strains or has COVID, their sample will not go to that level of rigor. So these are good estimates, but these are what has been found so far. We do have all three of those variants in the US. The only one that's been detected in Ohio so far, though, is the UK strain. Okay, vaccine progress in Lucas County, the part that you really probably want to know about. So we do have our notification list for individuals who are not in one of the current availability phases. That's on our website /COVID vaccine. So if you do fall into one of those groups that hasn't been called yet, you're under 60 years of age, and I'll talk about that in a minute, but you're under 60 years of age, you don't have one of the medical conditions, et cetera, you can sign up on that. And we prefer email if you are willing to provide it so that we can email out to everyone when their eligibility is current. We do have close to 70,000, probably over that now from the last couple of days, what's come in. And quite a few of those have been vaccinated. So we do remove your email once you meet that criteria, so you're not continually being bombarded. In terms of vaccination in Lucas County. So right now we have given over or just shy of 70,000 vaccinations. This is as of yesterday. We're 6th in the state for the total number of vaccinations given, but we are 1st or 2nd by urban counties for the percent of our population given. The only one that's kind of competing with us in terms of that 1st versus 2nd designation is Mahoning County with Youngstown, but they have about half the population we do. So in some ways, I feel like we may be first when you consider the bigger cities, Cincinnati, Cuyahoga County, Cleveland, all of that. Good news for the vaccine is that the Johnson & Johnson vaccine will be in Lucas County this week. It is being distributed. It did receive its emergency use authorization by the FDA. Many of you are probably aware of that already. So that will offer another avenue to get vaccination into individuals. The difference for Johnson & Johnson, if you don't know, is that it is a single dose vaccine. The efficacy of it is lower than Moderna or Pfizer from what they've shown in studies. But for individuals who might be concerned about that, the testing they've done has still shown a very high reduction in disease symptoms and disease state. And I believe from what I heard recently, there were no deaths following anyone who's gotten COVID. There has been no deaths when they've also received the J&J vaccine so far. So in terms of protection, even though the overall efficacy is a little bit lower in the high 60% versus the 90s for Moderna and Pfizer, it is still a very good vaccine, and it does offer an alternative because it is a slightly different vaccine in terms of how it's produced, what's in it. And again, the single dose might make it very, very good for certain populations that otherwise might have difficulty coming back for a second dose in 21 or 28 days. I want to talk just a little bit about the equity for vaccination. In Lucas County, we are working very hard to try to make sure that we have equitable distribution of our vaccine. A lot of that is in cooperation with the V Project. So I won't go into a lot of that detail, but as you can see on our slide, we are trying to allot at least 20% of our weekly allocations to those minority and communities of color. And there's a lot of information there that I can share the slides with. But we are trying to break down those barriers of access, increase the trust of those communities, and just try to make sure they are protected as they have been disproportionately affected by COVID across the country. We did get a shout out today. This is very recent information from the Ohio Department of Health. In terms of vaccination for African American reach, we are in the top 10, but more specifically, we're in the top 5 counties. So as a percent of the county population, we are doing pretty well as far as our vaccination of that community. All right, let's talk about the change in eligibility really quick. This week, Thursday, so tomorrow, there is a change in eligibility. It is moving from 65 down to 60 years of age. The medical conditions criteria has also relaxed a little bit. Now anyone who has type 1 diabetes can get the vaccine. Previously, it was you had to have type 1 diabetes and have been hospitalized in the past year for it. That's changed. Pregnant women are now eligible, same with bone marrow transplants and those with ALS. The other big change, there's 2 vaccination phases currently. There's phase 2, which is the age change, and there's 1C, which is what you see with the occupations as well. So those in childcare services, funeral services, and law enforcement officers are now eligible to receive the vaccine. In Lucas County, we make our vaccine appointments live on Thursdays. We've switched to Thursday evenings around 6 p.m. It used to be in the mornings. This is just because of a change in the way the state notifies us, or when we know exactly what we have received in our weekly shipment from the state. So that's how we make those appointments available. So those are always available by 6 p.m. on the health department website. Again, that's lucascountyhealth.com/COVID vaccine. There is a schedule link right at the top of every page of our website, but you can find it there. You can also find a link in a drop-down that talks about the eligibility groups on the COVID vaccination page. If individuals do need assistance scheduling vaccine, they can call 211. They can call the area office on aging. We try to be as accommodating as possible. But if you do fall outside of the criteria, right now you will be turned away if you do schedule an appointment. So just do keep that in mind. We're trying to vaccinate as many as we possibly can, as fast as we can, according to the eligibility that the state sets that we are obligated to follow. Okay, so I didn't know how much time that we wanted to spend from our side today, so just a quick short presentation. Do we have any questions on anything that I have covered?
Brandon, it looks like we do have a couple of questions in the chat, just in terms of ages and people who might live in a different county or those kinds of things. What I would like to do, if it's okay with you, is take all the questions at the end, but I think what I've seen are things that you can maybe reply to in the chat that everybody can see while we move on to Amy to get started with hers. How does that sound, everybody? Perfect. And then if those questions aren't sufficiently answered or somebody's still confused, when we get to the end, we can go ahead and take those. All right. Amy, there you go. Fantastic.
All right. Can everybody see that first page of the slide? Thank you. Okay. Okay. So now we get to talk about the legal considerations and complexities of the COVID-19 vaccine. We talked about this a little bit in the initial V-Project webinar. There are a lot of businesses who are trying to decide whether to have their employees, the vaccinations, make it mandatory or make it voluntary and maybe encourage them to get the vaccine, but not make it mandatory. I think one of the considerations you want to think about is, does your work environment require contact with a vulnerable population, or maybe with those who cannot be vaccinated? And in this case, you can think of nursing homes, medical care providers, or correctional facilities. Those are 3 of the obvious ones that make sense to really consider whether you want to mandate vaccines to keep everybody in your workplace safe. The goal certainly is to limit the exposure to patients, customers, and clients. And here's your test. You need to have a reasonable belief that vaccination is necessary to ensure employees do not pose a direct threat to the health and safety of themselves or others. Another consideration too is if you're a unionized workplace, you may need to consider bargaining with respect to your vaccination program. At the very least, you need to keep your union apprised of your decision-making and how you want to handle that. And if you plan to make the vaccine mandated in your workplace, also plan to pay for it and pay. I would encourage you to pay for time off to get the vaccine and also time off for those folks who have symptoms after the effect. If they get a fever or chills and things like that, they should stay home anyway, and you want to pay them some amount of time off to take sick leave as a result. In any event, whether you make it mandatory or voluntary, I always suggest you develop a written policy so that you can give everybody the same expectations so that they know how much time off they get to get a vaccine, whether it's 2 hours or a day, and whether they have time off after the effect, afterwards if they have symptoms, how to report those symptoms, how to keep their employer in the loop and let them know that they need some time off because they're experiencing a fever, something like that. The EEOC has told us we have 2 exceptions for those employers, for employees whose employers have mandated the vaccine. The first one is a disability exemption and the other one is a religious exemption. Under that disability exemption, this is an already established disability. It's not a new disability they've come up with, but that might prevent them from getting the vaccine. You always want to look at what are the reasonable accommodations, engage in the interactive process. You are probably, a lot of your HR professionals are used to doing this anyway. It's the same kind of analysis, case-by-case analysis. You can request proof of that disability if it's not obvious. And in this case, it might be a doctor's note, a health insurance record, or maybe a prescription. And you can refuse the accommodation, but only if the direct threat is still there. The standard for refusing that accommodation is that direct threat. And in this case, this is an employer, we need to show that an unvaccinated employee poses a direct threat due to a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by a reasonable accommodation. That undue hardship that an employer needs to show to avoid accommodating, in this case, is a very high threshold. It's significant difficulty or expense. And so you can't exclude an employee from the workplace in this case unless the reasonable accommodation is basically impossible. And that's going to be pretty rare. We've already accommodated a lot of folks when we're dealing with COVID-19. So we'll get to kind of some of those typical reasonable accommodations. And I think you'll see that you probably could find a way to accommodate. But if you can't, you kind of know what kind of threshold you're going to have to prove in order to justify that decision. These assessments are individualized, and here's the criteria that the EEOC has provided us in terms of how to consider or whether to consider these accommodations and whether that disability exemption will suffice. The duration of the risk. Is this something that will end at some point? Is the medical condition going to get better and will they be able to be vaccinated later? Or will the risk be reduced to the point where maybe you won't be mandating vaccines at some point later this year? The nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. Those are your criteria there. So now with respect to the religious exemption, this is a sincerely held religious belief, practice, or observance that equates to traditional religious views. Again, you need to explore whether you have a reasonable accommodation that you can provide. And you still have to show that if you can't provide it, you have an undue hardship. Under the religious exemption, it's the undue hardship definition is a lower bar. Here it's more than a de minimis cost or burden on the employer. And but I always recommend that you need to err on the side of sort of respecting that religious belief and the exemption that the employee is submitting. And if you don't know enough about that employee's religion or enough about the exemption, you can request supporting information and kind of discover more. Okay, so here's some reasonable accommodations that many employers are probably already using. You're probably already encouraging or requiring now masks or providing masks, gloves, PPE. You're asking people to work remotely. A lot of us have already been doing that. You could reassign people to less populated work sites or play around with different schedules. Here at our office, we have some staff coming in on certain days and the opposite staff coming in on other days. So you just reduce the amount of people in the office at once. I've also seen employers stretch out shifts so that maybe some people work more of an early morning shift and others work a later afternoon shift. We do know that political beliefs are not reasons to request an accommodation, so you have a right to refuse an accommodation on that basis. But as all HR people know, you got to document everything. So I suggest you document requests for accommodation and you document the agreements about what the accommodation that you have agreed to with your employee. Maybe specify that you anticipate this is temporary. For example, if you're going to allow somebody to continue to work remotely, document that your expectation is that you want this to be temporary because later during the year when it's going to be a lot easier to get back in the office or back in the facility, that you want them to be able to come back in as long as it's safe to do so. Those are good things to kind of get down on paper so that everybody knows how to plan for it and isn't caught off guard later. Okay, so if you're more in line with encouraging your folks to get vaccinated and allowing them it to be a voluntary choice, you also need to remember that the pre-screening questions that come along with getting a vaccination also must be voluntary. If you as an employer are setting up easy access for your employees to get it, or even a vaccination clinic on site, if and when that is available to you, you need to remember that if an employee refuses to answer those pre-screening questions because they are voluntary, you can decide not to administer the vaccine, but just remember not to retaliate, intimidate, or threaten the employee for refusing those questions. Many HR personnel are familiar with deciding or determining whether this falls under the category of a medical exam. So the EEOC has told us that the vaccination itself, the administration of the vaccination is not a medical exam, but those pre-screening questions may implicate the ADA or GINA, the Genetic Genetic Information Non-Discrimination Act. And so you need to remember that if you as an employer are the ones asking those questions, you could implicate those laws. I think it's best to kind of stay clear of that. And that may mean that you can encourage them to go to a pharmacy or a hospital and get their vaccination there. That's where most of them have been occurring anyway. So that seems to be the best way to go about it. Go to a place where they're not sharing that information with you as the employer, and then you don't know about it. So what can you do as an employer? You can request proof of the vaccination, but just request the date they got it, that they got it, or maybe the type of vaccination, and just prove that they got it. Don't ask, well, why didn't you get it? Because then you may be implicating the ADA or GINA again. So keep it simple. Just the proof or a copy of their card, something like that is appropriate. but don't go further. You could also encourage vaccinations by covering their cost, providing time off not only to get the vaccination, as we've discussed, and or possibly time off after the fact if they experience symptoms, and then offering incentives. Incentives have been a very hot button issue with my colleagues. We've been kind of keeping tabs on what kinds of incentives are allowed. I've heard from everything from, you can't go over anything of de minimis value to a $25 gift card to a whole bunch more money. These concerns are the same concerns and are kind of analyzed under the wellness program analysis. So if you have a wellness program and you're familiar with some of the limitations that you're allowed in terms of those incentives, that's probably where these incentives for getting a vaccination fall. Just be careful. What you want to do is you want to think through, if somebody has a disability and would get a vaccination but can't, how does it look if you're providing a big incentive to all those other folks who can get a vaccination and did? So that kind of helps you make sense of why they would limit the incentives for this. And if you are hosting a vaccination on site, make sure to coordinate with your local health department to make sure that everybody's taken care of there. Okay, we're going to shift a little bit to COVID-19 related litigation. A lot of my clients are curious about curious about what's happening with respect to litigation, and I want to help everybody try to stay out of trouble. So you can kind of keep tabs on what people are complaining about, and steer clear of those areas. So far, over 100 cases have involved sort of COVID-19 related litigation in the country. This is that's based just on the manufacturing industry. Of those cases, 95% of them have been brought by a single plaintiff. So far, we haven't seen a lot of class action cases. And of the top 5 states, Michigan and Ohio are included in those states with the most manufacturing industry COVID-19 litigation. Here are the categories of those manufacturing industry litigation cases: contract, disability, leave and accommodation, discrimination or harassment, retaliation and whistleblower, wage and hour, and workplace safety and conditions. A lot of my clients wonder about the impact on workers' compensation. So if you mandate the vaccine and one of your employees has an adverse reaction, does that fall under a workers' compensation law? Do they have a workers' compensation claim? The answer is it's possible, yes, especially if you mandate the vaccine. So if you're considering, you can take that into consideration when you're deciding, and it may be a reason that you lean towards a voluntary vaccination program as opposed to a mandated one. Okay, under that category that we just listed under the manufacturing industry, about half of those cases, those COVID-19 related cases, fall under that disability, leave, and accommodation type of claims. A lot of them include a wrongful termination claim. For example, if you had layoffs that became permanent, did you lay off the folks who maybe were in the vulnerable population in your workforce? I had some employers who thought, well, we'll keep them safe, so we'll make sure those folks are the ones who get sent home first. And that was with all good intentions, but we had to make sure we pulled back and said, wait a minute, we're making a decision based on a perceived disability or age, for example. Those are the types of claims that are starting to pop up, and the other types under this category include those interference with rights regarding FMLA and our new law FFCRA, which sort of ended from a mandatory basis in December 31st, and then similar claims under state discrimination laws. So I think my lesson from this is that as an employer, if you're continuing to focus on getting those leave requests looked at properly, engaging in the interactive process, and really analyzing whether you can reasonably accommodate somebody. If you get those right, you're going to be able to avoid a lot of the COVID-19 related litigation that now is coming out quite a bit. And then under the discrimination, harassment claims and retaliation and whistleblower claims, we're also seeing wrongful termination claims, retaliation for complaining of an unsafe workplace. A lot of times I talk to clients about if they're defending multiple claims, and it might include some sort of discrimination claim and then a retaliation claim. Sometimes that initial discrimination claim is not the strongest claim, but because the employer or somebody at work reacted to that complaint, then they have a retaliation claim, and the timing of that adverse employment action, discipline, or even termination happen right after they complained about something else. And that makes their retaliation claim stronger. So if you take all those, complaining about an unsafe workplace, it's really important to make sure you take that seriously, take that respectfully, make sure you are following the rules, and respond to the employee if you need to, that yes, you're following the rules, or no, we caught something and we fixed it, and make sure you train your employees not to retaliate against that employee for complaining. Okay, switching gears again, the CDC has issued new masking guidance. My impression from it is they want you to do a surgical mask plus the cloth mask, not 2 surgical masks, for example. So if you're already supplying cloth masks or surgical masks, keep doing so. If you want your employees to double mask, you might consider going ahead and supplying those masks, especially the surgical mask, I would say. And then also make sure that you accommodate people who just can't tolerate 2 masks. And that's also in the CDC guidance. Communicating with employees, I think, is the best way for you to reduce litigation and have a healthy workplace. The CDC has provided several toolkits that allow you to customize for your own workplace and just give you some starter tools to start communicating with your employees about what your expectations are with respect to masking, even hand washing, information about the vaccines and why they're safe, so those have been really helpful. They specifically have toolkits for essential workers, all types of essential workers, and then also medical centers, clinics, clinicians, and long-term care facilities. I would encourage everybody to go on the CDC's website, search those out, because I think they can be very helpful and simple for a lot of employers to utilize. Now, if you're having issues and work conflict with employees who are arguing about politics or maybe the anti-vaccine movement, you should know that it's possible as a private employer to instruct your employees not to talk about politics at work. That doesn't necessarily violate their First Amendment rights, but the NLRA Section 7 is going to protect protected concerted activity. So if you have several employees who get together and protest a mandated vaccination program, that may be protected activity. So you really have to be careful. You also have to think about your workplace culture and whether it's worth it to tell everybody not to talk about politics at work. This is another place where you really can. Communication is so valuable and so easy sometimes to get your goal accomplished. And remember that the NLRA applies both to union workplaces and non-union workplaces. So make sure you follow those rules. Okay, so now that some employees or maybe all your employees are vaccinated, what do? You need to continue to mask, social distance, and continue to follow those rules by the CDC and OSHA. If people are feeling sick or think they have COVID, continue to make sure that they stay home. Keep apprised of the CDC's latest guidance on quarantines. They've been shortening timelines and also changing timelines, I think, on folks who are vaccinated. So keep advised of that. And don't distinguish, just like we don't want to distinguish between vulnerable populations with respect to decisions at work, we also don't want to distinguish between vaccinated and unvaccinated employees. And again, communication is key. So if you can communicate well about your expectations with masking and social distancing, you can reduce misunderstandings, which will hopefully reduce people reporting that my colleague isn't wearing his mask if everybody knows they're supposed to be wearing their mask. And hopefully that would decrease the amount of OSHA violations you have and retaliation claims you have at that point. So hopefully we've been able to help you kind of figure out whether you're going to mandate or make your program voluntary, and kind of the analysis that you need to undertake. If you're going with the voluntary route, you can follow appropriate and effective ways to encourage vaccinations. And you can kind of plan to continue the guidance following the CDC and OSHA guidelines and avoid misunderstandings in the workplace. So thank you.
Well, thanks, Amy. I appreciate that very, very thorough information. And I know for myself, was excited to have the change in the guidelines just recently to 60 and over. That means that I am now eligible. So I'll give you a little hint about my age group in there, but I will be signing up for that very soon myself. What Amy just shared with everybody was sort of what you can do or what you should do in many cases. I wanted to share with you today just a little bit about what we're finding employers are actually doing. So we did a survey recently to ask our members of the Employers Association what they're planning to do regarding vaccinations. And so hopefully you can see here on this the results that we have. First, we ask about, are you requiring a negative test for people coming back to work if they've tested positive? And only 10% of employers said that they are actually doing that right now, which again I think fits with the CDC guidelines that you don't necessarily want to do that. You could do that, but most employers are not right now. And then we started asking, which I think is most relevant here to this V project idea, is what's your company's stance on employee vaccinations? And as you see, in this survey, again, we had about 104 companies respond to this. 0% said that they were going to actually require the vaccination of their employees, which again fits with what Amy was saying, because in many cases, if an employer is going to require that, they really do need to have good reason to do that. And most employers probably shouldn't be. And one of the things that I've heard also is that even those employers that maybe will require them at some point may not do that until a little bit later on. It's the vaccination is widely available, although it's becoming widely available now. But it even goes beyond. Right now, the vaccinations, and Brandon could probably speak to this better, is still under emergency authorization. But there's, at some point they will be fully authorized, and maybe at that point employers might start to require that in some certain situations that are allowed by the EOC. And so Amy touched on this also about whether employers are actually offering incentives to employees to get their vaccines. And at least as of the time that we did this, which was I believe in late January, early February, so it's a little bit dated already because these things are changing so quickly. But at this time, only about 10% of the employers were planning on offering some incentives. I think that's probably changed already. I think as as the vaccines have become more readily available, I think more companies are thinking about this. I think this V project is probably having some influence on that as well, that the attention is being brought to employers, and I think they are starting to think about offering these incentives. So some of the incentives that they are saying that they did offer or will be offering are some of the things that Amy mentioned there also. A day off for people completing their vaccinations, getting both doses, or with the Johnson & Johnson variety, maybe that'll just be the single dose that they have to get there. Several companies mentioned here that they will allow employees time off to get their vaccinations on there. I think that's going to be a very common incentive for employers to provide that as well. Now, this next one that you see on here, I think probably both Amy and Brandon would say they may want to rethink whether they really do this or not, because they talked about allowing, if they have 80% of the people vaccinated in their workplace, that they would say that they no longer had to wear a mask. That's probably not the right thing to do here right at this point on there, but I thought it's interesting that that's thrown out there as an opportunity for that. Others are doing things just more educationally, saying, hey, we will provide information where these vaccination sites are going to be, or they're going to try to get vaccinations done at their site, which I don't think is available just yet, but I would expect that may be, and Brandon maybe. Brandon, is that a fact at some point? Are they going to, do you think that there'll be opportunities for companies to actually have vaccinations done at their work sites?
So it could be a possibility. Initially, when vaccination was becoming a reality, we were encouraging those signups to say, do you want to be a closed pod, which means just your staff and facility, or an open pod where members of the public could come. More recently, we moved towards promoting just the larger pods, because we can do much better throughput. The average wait time, just to speak to your allow employees to take 2 hours off, at one of the health department pods, the average wait is a half an hour. And that's from arriving on, or getting through registration, getting your shot, the 15-minute wait time, and you're out the door. So that is actually a very reasonable time, as long as they can travel to the site and back and account for that. But once they're registered, it's very quick. We have great turnaround in that regard. So.
Okay, all right, very good. So those are the types of things that I see that employers are starting to do, and I think they are becoming more aware, and they will start to offer more incentives. I think, as Amy said, I think for the most part, it's probably wise from the EEOC standpoint to only offer de minimis types of incentives on there to prevent any discriminatory practices. So I had one other thing I wanted to point out there, and it was actually a question, and Amy, I might ask you to weigh in on this also, but it kind of ties in the idea of people waiting to get vaccines, and the extension of the expanded family medical leave availability. Of course, the emergency paid sick leave and expanded family medical leave, the requirement to provide that for employers expired on December 31st, but employers can still do that through March 31st. I had a member question me the other day, said, hey, they had an employee whose parents were providing childcare for the employees' children, and they got the grandparents got COVID, and so they were unable to watch the child for a couple of weeks, and so employee had to stay at home, which seemed to me logical that they would be eligible for emergency paid sick leave, because their child care provider in that case wasn't available because of the fact that they had COVID themselves. But then the next part about that was the grandparents didn't want to provide childcare until they had been vaccinated. And so the question was, would they continue, would that employee continue to be eligible for the expanded family medical leave? And And although I'm not an attorney and I make sure I don't give legal advice, I answered much like an attorney, and my answer was it depends. And my view of it was it really depends on whether they were advised to do that by a physician, by a doctor. If they were advised, then that may be make that employee eligible because their child care provider wouldn't be available. But if they just chose not to do that, seems to me that they wouldn't be available. So Amy, I don't know, do you agree with that assessment?
I do agree. And yeah, I think there's a list of questions you do have to consider, and if you want that FFCRA benefit, that paid leave, and if the employer is still voluntarily providing it at this point, you need to make sure you have enough leave to spend. And you're right, I think a voluntary closure of your childcare provider probably would not fit the criteria of it being unavailable, and whether that person can find other available childcare. I often advised employer clients to work whatever deal you can with your employees. If there's two parents at home and one parent can work half days and the other parent can work the other days, maybe you can make that work and they don't even have to spend the FFCRA time, and you get a productive employee for at least most or part of their work day, and you've worked with them and you've stayed flexible. So it is all about being flexible, but I think I agree. I don't know that that would fit the criteria.
Yeah, good. All right, thank you. Again, I don't offer legal advice, though. I just want to make that clear. So, all right. So that's everything that I wanted to share here today. And I know we have a few minutes left to take any questions on there. Julie, were there questions that showed up in the chat that we ought to address?
Yes, there is. We did get one question that just came in, and Amy, I believe this one would be directed to you, maybe Bob as well. Can we ask for proof of a vaccination from a potential, not hired yet, staff? So I guess basically a requirement to work there is that you're vaccinated. So not requiring the vaccine. Oh, let me read further. Not requiring the vaccine, just proof if they tell us they have been vaccinated.
Amy, I'll defer to you on that one.
Yeah. If you're asking all of your other employees, even if it's a voluntary encouragement type of program that you're putting on, if you're asking everybody else to provide proof once they get the vaccine, I think that would be appropriate. I probably advise to just wait until they come on board. I don't know that that would be, if you're not requiring the vaccine, I don't know why you would want to make that part of a category of potential reasons you wouldn't want to hire somebody, and then they might have that excuse to to complain later about why they didn't get hired. So I'd wait till the onboarding process if you're also asking everybody else for the same proof.
Yeah, it seems likely to me also that makes sense. It's almost like a post-offer employer physical that somebody might take. You really wouldn't want to do that ahead of time. It doesn't seem to me either. So, anything else, Julie?
Yes, we've got one here. There is an acronym that I am not aware of, but if an employee is out on PUA, can we require her to return to work once she is vaccinated? She does not want to return, even though she is vaccinated. She wants to continue to get unemployment.
Unemployment is usually only available if you don't have work for that person. And so if you have work for that person, then she or he should be invited back. And if you're providing a safe workplace and you can demonstrate that, I've advised other clients to explain how important that employee is to your workforce, and that the workplace is safe. It's even safer now that more of the workforce is vaccinated, for example. We're still masking, we're still social distancing. Is there a way for you to come in on a flexible schedule? Is there a reasonable accommodation you request? Go through that process. And if they still decline to come in, then it may be considered a voluntary resignation. But it really just depends on the situation and whether you can find some sort of accommodation for that person. Bob, do you have any other perspective on that?
Yeah, I agree with you. I think if that's the case, if there's no real reason why they shouldn't return, I would take the steps. I would recommend that the employers take the steps to report that person has turned down available work. And I know, I mean, the challenge with unemployment right now is they are still very overwhelmed, and especially with all the fraud that's going on right now, and that's a whole nother issue we could talk about for a period of time. But I would still take the steps to report that they are turning down available work, and it's a safe workplace.
There, I see a statement in the chat, but not another question. If there are, we're 5 minutes ahead of time. So if there are any other questions, please, go ahead and get those in the chat now. But I do want to take this time to thank Brandon and Amy and Bob for this fantastic information. Again, we will go ahead, and this session has been recorded, and we will share that recording. We'll just email you the link to everybody. Give us about 24 hours on that is generally what our turnaround is on that. Just a reminder, this is a series that we are doing. They are not series that requires attendance in the first one. It is similar content, but brought up to date from whatever might happen from the week before. Presented by some additional expert presenters in our community. So you can feel free to log into any of those. They're not duplicate sessions, but they're also not concurring, so that, for example, you had to be in this one to sit in on the next one. So, and share that link with maybe colleagues who you think might benefit from hearing this as well. So again, I did put that link to the V project in the chat, so you can take a look at that. And with that, I will say good afternoon to everybody, and thanks for joining us.
Julie?
Yes.
If I could just say one more thing?
Yes.
Just to add to the incentive for those who might be on the fence of whether you want the vaccination or not, because I know the sentiment is out there, well, I'll just get COVID and I'll be fine instead of getting the vaccine. All of the vaccines have shown cross protection to those variants. So again, it's not 100%, but it's better than not having it, and they've all reduced disease. And the other side of incentive is quarantine, as was mentioned earlier. The CDC has released guidance that anyone who is fully vaccinated, meaning that you are 2 weeks past your last dose, whether that's your second dose of Moderna or Pfizer or the first dose of Johnson & Johnson, if you are 2 weeks past, but less than 3 months at right now, that'll probably change, and you have remained with no symptoms, you do not have to quarantine if you have an exposure. So if you meet those 3 criteria, you do not have to go into that 14 or 10-day quarantine if you are exposed to a positive or suspected case. So that is another large incentive, both for workplaces that interact with the public generally, or just for your own staff and peace of mind.
Thank you. Great information, Brandon. So, and again, to Bob and Amy as well. So thank you so much, everybody, and enjoy your afternoon, and thanks for joining us today.
Thank you.